helping make your life easier. Moms Every Day.
Coughing, sneezing, itching, and wheezing. Kids with allergies can face a lot of miserable symptoms, and these troublesome allergies can affect how your child sleeps and plays. Dr. Petra Razdan is here from Allergy, Asthma and Immunology Associates, and she has advice on recognizing allergy symptoms early in your child. Nice to see you, Doctor.
Nice to see you.
Yeah, so what is allergic rhinitis?
So allergic rhinitis is in layman's term hay fever. That's when you have allergic symptoms primarily in your nose. You can also have eye symptoms that can be either seasonal, like spring and fall, or all year round, perennial, to things that are in your house, like house dust mite, your cat, and your dog.
So why is it so important to identify these early?
I think children sometimes get a call that they just have a cold all the time, and that's when mom treats it as a cold and that symptoms don't improve. And the children that have very bad allergic rhinitis can go on and develop asthma, in particular if there's a family history of that. So I feel it's very important to early on diagnose it and treat it.
Well, how do you diagnose? I mean, how does mom know the difference between a cold and allergies?
Right. So I think the history is very common, unless you see that they also have body aches, a high fever, it occurring outside of cold and flu season. It's occurring very much in, for example, August or springtime when pollen counts are high, and they respond very well to antihistamines. And ultimately, we skin test children to identify the allergen.
Okay, so then, again, maybe talk about how you treat it.
So first of all, I think it's important to identify the culprit, and you can also remove the culprit if it's a cat or a dog. You can treat it with over-the-counter antihistamines, whatever of your choice. I think intranasal steroids are great. They're wonderful. And saline wash is not to be underestimated, even though it's not a medication. And also, ultimately, how you treat it and change that condition is with allergy shots that are given over time.
Is it different how you treat a child versus an adult?
It is, of course, what you will choose, but it's pretty much the same. A young child that's less than 4, I will not put them on allergy shots. I will try some over-the-counter medications. You can try, for example, single air. That's easier to administer rather than a nose spray for a young child. So it definitely changes with their age.
And when should you have your child treated? As soon as possible?
You know, if you have a child that's 6 months old that seems to have a cold a lot, I would say no. You should wait. You have to have a couple of pollen seasons in order to be sensitized to the allergen. So wait until they're maybe 4 or 5 years old to be skin tested.
But maybe come to you just to be checked, right?
I think it would be good to give guidance and to kind of see when you should be ready for things, in particular if the family history is strong for allergies.
Okay, thanks, Doctor, for being here.
Welcome.
And for more information on childhood allergies or Allergy, Asthma and Immunology Associates, visit Moms Every Day or download the Moms Every Day app.
Visit Moms Every Day online or on the go through our Moms Every Day app. Download it today to find local solutions for you and your family.